Stephen, thanks for being here on New York Now this week. I appreciate it.
Dan, thank you for having me.
So you lead a group that represents several nursing homes around the state, and nursing homes are a hot topic during COVID-19, obviously. I feel like everybody is trying to blame somebody for the thousands of deaths at nursing homes. Some people are pointing their fingers at the state. Some people are saying it was the nursing homes themselves. And I get it, because families are going through a lot right now, losing their loved ones. Walk me through what happened here with nursing homes in particular.
Really, what we are dealing with as the nation and the state prepared to deal with this pandemic as it presented itself on our shores, first in Washington and then in New York, was really the focus on hospitals and a lot of the perspective of we need to ramp up hospital rooms and hospital capacity, which made sense. So as this virus presented itself into our state, and nursing homes and assisted living providers really advocated to have equal priority with hospitals for PPE, for staffing, for testing, and we were dealing with a confluence of issues. We were dealing with a highly contagious virus that knew no boundaries. We were dealing with staffing issues because what we had here, the first time ever, we had schools closing and staff had to care for their children, and that presented significant issues. So we had those issues. Then we had staff becoming ill. And this is all when we were going into COVID-19, we were dealing with circumstances where New York was experiencing a healthcare workforce crisis. And then we had shortages of PPE. Personal protective equipment, and really trying to get masks and face shields and gowns and things of that nature. Fundamentally, though, Dan, was the recognition, and we learned this later through the virus, that over 25% of individuals infected with COVID-19 are asymptomatic. And really, that presented a significant issue in nursing homes, assisted living facilities throughout the state and throughout the nation.
So the state at the end of March issued this directive that said that nursing homes couldn't discriminate against COVID-19 positive patients, meaning that nursing homes had to accept these patients into their facilities. Do you think that was a mistake? Do you think that the state should have kept COVID positive patients out of nursing homes?
The March 25th guidance from the State Department of Health was intended to deal with hospital surge situations, exigent situations where hospitals were running out of beds and they needed to provide a placement for patients who needed care who couldn't return to the community. I think at that time when that guidance was issued, providers presented a lot of concerns because at that point in time, many providers had to date not had COVID enter their buildings. It was never an issue of whether or not the nursing home could care for those patients. It was an issue where the nursing home could not either request that that patient be tested or refuse admission to a patient that was presenting symptoms and not being tested. So it raised real concerns, but nevertheless, those patients, as a consequence of that Department of Health directive, came into nursing homes. And quite frankly, we cared for them, we provided care for them. And as we went through this pandemic, we cohorted those positive patients away from non-positive patients. And really, as we gained access to PPE and as we gained testing access, we really learned, working in partnership with the Department of Health, with the state, how to care for those individuals who are positive and really safeguard the negative residents from contracting COVID and really cohorting those patients away from each other.
All right, Stephen Hance from the New York State Health Facilities Association, thanks so much for being here. This is a perspective that I think is hugely important to this conversation about COVID-19.
Dan, thank you very much for having me.